Ever pondered on why humans think, feel, and behave the way they do? Well, that's the fascinating world of clinical psychology. It's about understanding, preventing, and relieving psychologically based distress or dysfunction. But how does this all work in practice? Let's delve right into it, shall we? Picture this. A man named John, in his mid-30s, has been feeling persistently low and uninterested in life. He's been having trouble sleeping, eating, and even concentrating on daily tasks. For the longest time, he dismissed these feelings as just a phase. However, the phase seems never ending, and John's life is spiraling downwards. This is where clinical psychology steps in. John decides to seek help and consults a clinical psychologist. The psychologist doesn't just listen to John's problems, but digs deeper. They explore John's past, his relationships, his work life, his fears, his dreams, everything. The goal? To understand the root cause of John's distress. The psychologist then conducts a series of assessments. These assessments are not just about understanding John's mental health status. They also aim to understand his cognitive abilities, personality traits, and behavioral patterns. The psychologist uses scientifically validated procedures to help John understand his problems better and, more importantly, how to overcome them. John's treatment plan is personalized, designed specifically for him. It's not a one-size-fits-all approach. His psychologist takes into account his unique circumstances, his strengths, his weaknesses, and his goals. They work together as a team to help John reclaim his life. John's journey is a testament to the power of clinical psychology. It's about understanding the human mind and behavior, yes, but it's also about change, growth, and healing. Clinical psychology is not just about diagnosing problems. It's about helping individuals like John navigate their way through life's challenges, empowering them to lead healthier, happier lives. In conclusion, clinical psychology is a multifaceted field that goes beyond treating mental illnesses. It delves deep into understanding human behavior and the myriad factors that influence it. It uses scientific methodologies for assessment and treatment, always personalized to the individual's needs. And most importantly, it's about empowering individuals to overcome their struggles and lead fulfilling lives. So the next time you ponder on why humans think, feel, and behave the way they do, remember the work of clinical psychologists. Remember the Johns of the world who, with their help, are able to turn their lives around. Because in the end, clinical psychology is about humanity. It's about understanding, and it's about change. And that, dear listener, is the fascinating world of clinical psychology. It's not just a profession, it's a calling. It's not just about understanding the human mind, it's about making a real difference in people's lives, one individual at a time.